Thank you so much, Anton, and good to see you all. So I will try to run very quickly through my slides. There are a lot of them, because International AIDS Conference is a great resource, actually, which can be used not only during a couple of days of the conference, but afterwards as well. So I am going to run through this presentation, actually just flagging some of the highlights here. So in regard to the conference highlights, so there are several areas I would emphasize: vaccine and cure research, IRT and co-infection, HIV prevention and sexual health, communities in the center, improving HIV care and sustainability and economics. And additionally, I put several slides highlighting specifics for the region. So I'm not a clinical specialist, so for me, I will not go. Wow. Yeah, so on vaccine and cure, so there are several presentations were made highlighting for me. So there was a presentation of the fifth person free with HIV. No, I think it's okay. After stem cell transplant. So there is a reference here. All presentations will be provided to you, so you will have more access to this material, well, to the presentation, but if you are IAS member, to much broader information there. So it was also a case of Barcelona patient also, which was updated and presented at the conference, who combined IRT treatment with immunomodulators. Then it was another case of cure within vaccine and cure research on from South Africa, South African child who also was part of the study and now has undetectable HIV. There are also presentations on hidden HIV DNA and as well as on immunotherapies for cure. Besides, there were several presentations, key presentations on HIV vaccine research. I don't have time to go through all the slides, but as I said, there are background references here in the presentation as well. In regard to IRT and co-infection, the big attention was paid to the mortality, and the main cause of the mortality is actually TB, as well as cryptococcal meningitis. So in 2001, 650,000 people died, and this remains a major concern in HIV response. There was a presentation referencing WHO guidelines and specific recommendations for reducing mortality, in particularly for co-infection, HIV, TB co-infection with course of oral bedaquiline, pritamanid, and linezolid, and monofloxacin. Even visually, you have the differences also from a patient perspective of number of pills to be taken with this more effective and advanced course in comparison with the traditional care. There were also studies on hepatitis B and HIV co-infection also, which showed results of Biktarvy in particularly, which are quite promising. Again, keeping these slides rather for the reference due to the lack of time. In regard to HIV prevention and sexual health, one of the key innovations which were presented was taking antibiotics after sex to reduce STIs. Well, we know the trend also with PrEP, getting more available STIs are getting more spread. So this presentation and study actually were very exciting innovation, because as you see also on the graph on the which shows well, I mean, results of doxycycline taken after sex reduced STIs by 66% in HIV-negative participants, PrEP cohort, and by 62% in participants with HIV. So both cohorts were part of the study. So this is one of the innovations presented at the conference, besides emerging issues which were discussed, such as monkeypox and monkeypox was discussed, of course, not only from the scientific perspective, but also from a perspective of access to vaccine. Actually, vaccination was available on the sites of the conference as well. So you see the protest demanding access to vaccine. Improving PrEP. PrEP was also very in focus of this conference, and kind of in regard to PrEP, the key things were, again, scientific studies, including long-acting PrEP. We will have a dedicated presentation later in this session from Chloe Orkin. But also in terms of mode of provision of the PrEP. So on the slide you see the dynamic in Brazil, where nurses prescribe PrEP, thus increasing access to PrEP by key populations, sex workers and people who use drugs in particular. And it changed the dynamic with race of the PrEP participants. So before this, when only doctors prescribed the PrEP, majority was white people. But since nurses started to do this, majority was black people. So it also kind of reflects a kind of easy threshold and friendliness of the providers. Another PrEP-related study was presented from Vietnam, and you see the breakdown, which still in the description, when actually 32% of PrEP participants are getting it from key populations at clinic, not just medical facilities, 23% through telemedicine or telehealth, and then private clinic and mobile services. This is what is needed in our region, where it's very medicalized and sometimes restricted only to medical clinics as a sites for PrEP. Another study on PrEP is linked to long-acting, and we will have a separate presentation on this, but this is another big issue and very relevant to our region as well. Another thing within HIV prevention and sexual health is actually injectable long-acting CAP, cabotegravir, and dapivirine vaginal ring, which both these studies were presented at the conference. Besides, on U=U, there were several presentations showing the kind of while scientific evidence is very clear, showing some resistance or stereotypes in accepting or promoting U=U in several cultural contexts. So now, for example, PrEP, new guidelines from PEPFAR asks countries to integrate U=U into messaging for HIV services. Communities in the center, I'm so glad to have it as one of the highlights for the conference. And of course, key populations are the key in addressing HIV, including in our region, so in regions driven by the concentrated epidemic. So there were also several studies on applying WHO guidelines, which were launched. New recommendations developed under the grading recommendation assessment, development and evaluation approach, and also in terms of the priority actions to end HIV epidemic, it also overlapped in time with the launching of the UNAIDS in danger report. And if you recollect, it shows vulnerability and risks for key populations to acquire HIV. For example, for people who use drugs, 35% higher than average adult person. For sex workers and men having sex with men, transgender people, slightly low, but again, shocking difference between the kind of average adult. So does it comes with more resources, with 35 more resources invested, or with efforts, additional efforts, which should be in terms of reaching 95 targets in this group? Inclusion is very important issue, including for trans people in national responses in CCMs, and it's already showed it benefits from the studies in countries where it was done. On improving HIV care, well, differentiated service delivery for HIV treatment was substantially and widely discussed there. Another thing which I would like to highlight is to follow the best kind of person-centered needs in addressing differentiated approach, including for people with patients with co-infection. Mental health, another topic. This map shows how medical facilities addressing and receiving HIV patients able to address mental health issues, including screening for depression, anxiety, and post-traumatic stress disorder. And well, this is the map which is not covered our region. Nevertheless, it will be useful to have the same for EECA countries. And you see the dynamic in those selected countries that actually percentage is quite low, especially for provision of medication, both screening and medication, which is kind of right columns, blue-green column, and it's higher in urban settings and clinics in high-income countries, but in low-income countries is almost 1%. Well, a person-centered approach for young people and some factors sometimes not taken into account, like change in school or pregnancy or some other factors, can have decisive influence on treatment adherence and other essential parameters. So on long-acting injectables, we will have the next presentation, so I would not stop here. We will have Mitchell Warren live with us, so I'll move on with the next slide, which is which is also actually continuation of the long-acting, which shows that it's a high demand and high readiness for and high expectations for long-acting. Well, moving forward with sustainability and economics, so making long-acting cabotegravir PrEP accessible and affordable is a key task, also set at the conference, and we earlier heard Mila Maestat from MPP perspective described the voluntary licensing process, which is still, it's a good direction, but it takes 3 years to implement. So that's why we need more efforts besides MPP to be implemented to make this medicine available. So there are several examples which presented effectiveness and sustainability of PrEP, for example, in Thailand, where 6 steps approach was applied and PrEP was integrated into national insurance health security fund. You see on the slide that the blue part down is actually reflecting the PrEP component paid covered by the government. And for community-led response and HIV programs, so there were also some discussions linked to the funding level, who actually funds community. And there was a gap and there was a need to have prioritizing funding for community, both in large institutional funding, in social contracting, and in catalytic investments. Few slides related to the region. So one is, I didn't have time to select all the presentations, but especially IAS members, you have access to all of them. And there are few highlights from the session, from the entire conference, highlighting focus to the region and to our region. Another big thing which was visible at the conference is presence of the Eastern and Central European and Central Asian Commission on Drug Policy. President Kwasniewski was there, Professor Michel Kazachkin was there, and we had several sessions and very substantial media coverage for this commission. So it was one of the highlights of the EECA agenda. Of course, Ukraine was very much on the agenda. That is the session run jointly by Global Fund, PEPFAR, and UNAIDS, and you see Olga Gvozdetska, who presented also at our meeting here virtually, and key donors and stakeholders, including from our organization. And this is a final slide also. This is kind of some good outcomes on the side of the conference. During the booth, that's I'm presenting not with my IAS hat, but with the Alliance. So we collected some money for a sanitary van, some mobile clinic, evacuation mobile clinic for wounded people. And we expected to gather some funding for one bus, but we bought two actually. You can see on the right photo, and it was also great support on the sides of the conference from participants, from all people showing solidarity with Ukraine. Presentation will be available for you, and there are also links and reference materials within the presentation. So thank you so much.